check. I think everyone can hear me. Great. Thank you for being in today's attendance. I'm sure it won't come as a surprise to anyone in this audience that there are millions of cases of foodborne illness every year, and unfortunately, tens of thousands of those leads to deaths. That's essentially why we're gathered here, to try to prevent those types of things from happening. But if we allow ourselves for a minute to look at the glass half full, if it weren't for the tireless efforts of public health agencies and regulators that are going into food establishments and doing inspections on a daily basis, surely those numbers would be much higher. And if we look back 100 years, 200 years, there's a reason why the life expectancy was so low. And that is why I'm so excited to be here today to tell you about our mission and how we serve it, which is essentially to connect private industry with regulators through technology. Here, I'm blanking for a quick second. At Hazel Analytics, our core focus is retail food inspections. Essentially, I think I lost my mic. Essentially the last step of the farm to fork equation. And it's a very messy data environment for a couple of reasons. First, it's at massive scale, and secondly, it's tremendously fragmented. Let's consider a few numbers for a second. In the US alone, there are over 2,500 local health departments. The average top 100 chain in the US has over 2,000 locations. And some of the leading food delivery platforms have over 300 restaurant partners. So numbers like this make an already difficult topic like food safety especially challenging. So big problems don't just need bigger solutions, they also need smarter solutions. And that's what we try to deliver at Hazel Analytics. Based on university research from UCLA and Stanford, we've developed data-driven technology to basically connect the private industry with regulators. We were founded in 2014. We're based right here in Seattle, just across the water. And today we have nearly 200 users across food service, food retail, and delivery. We work with almost half of the top 100 chains, and we have over 100,000 food service locations being monitored by our platform. But what is it that we do exactly? I haven't told you that yet, so let's jump into that. Number one, we are collecting data in an automatic fashion around the clock from over 1,000 health agencies across the US, Canada, and the UK. Second, we are standardizing the data, and that means a few things. First and foremost, we are normalizing it, which means that we are putting it into a common format. We're also enriching it, so we fill in gaps in information using machine learning and other types of techniques where it's needed and where it's possible. Second, we've developed our own proprietary scoring system that allows our users to do cross-jurisdictional comparisons and to generate other types of insights, which we will cover shortly. And finally, it's analytics. We've developed a number of software solutions for different types of stakeholders in the food industry to be able to easily interact with the data and to be able to take advantage of those insights. And we've developed quite a bit of deep expertise in each of these areas, and we're leveraging some interesting technologies and data science principles, and I'll cover just a few. For data collection, we've developed a technology infrastructure that has over 300 data bots that have automated intelligence built into them to do things like load balancing, so we're not overwhelming the public agency websites. We have automated error detection and recovery, and also we have optimization for collection speed. With respect to standardization, here there is a lot of machine learning, a lot of natural language processing to enable things like categorizing violations, standardizing violations against a common format, and also doing predictions around re-inspections. And finally, in analytics, this all comes to life using very modern software frameworks. We want our tools to be fast so that you're not waiting seconds and minutes for data to load. We want it to be mobile enabled so you can use it on any device. And finally, we want to give you domain-specific analytics that matter for your role and for your business. So how does this all come to life? I'm going to take you on a few different real-life use cases. We're going to be looking at some actual screens out of our actual customer dashboard. We've just redacted names to protect confidentiality. And Before we do that, I just want you to imagine that you're a typical user of ours, which oftentimes is a corporate food safety team member at a large QSR that is managing hundreds, if not thousands, of locations. And I believe that's our judges today, so that's very convenient. So one of the capabilities of our platform is to deliver you KPIs right out of the box. One of the most popular ones our customers like to look at is how they're doing from the number of violations that they're being cited. So the chart on the left, which I'm sure is a little hard to see, is showing you your average number of violations per inspection, broken out by regular violation as well as critical violation, and it's showing you how you're trending from month to month. We also give you a year-over-year trend, so you can see how you're moving the needle. In this case, there's actually been a 9% increase in violations, which is obviously not good. On the chart to the right, we're looking at critical violations and how they're distributed amongst inspections from 0 to 5 or more. And in this case, we have some trends identified as well. The number of inspections that had no criticals has gone down by 6%, which is not a good thing. On the other hand, that's offset by the fact that the worst inspections, those with 5 or more criticals, has gone down by 19%. Continuing on with the theme of KPIs, a lot of our customers are interested to understand the types of inspections that they're getting. Everyone, of course, is subject to routine inspections, but the ones you don't want to see as much are complaints and re-inspections, which are shown in the yellow, which is hard to see, and complaints are the red line. And in this case, there's really a negligible trend of re-inspections increasing by 0.7% year over year. And if we drill into re-inspections and take a look at the outcomes, we see that the majority of our re-inspections are passing without further incident, which is definitely a good thing, 57%. But there's still 43% that are resulting in residual violations. And the bad news is that year over year, those sort of unsatisfactory re-inspections have increased by 10%. So enough KPIs, let's talk about benchmarking. This is an area that a lot of our customers are a big fan of. They're able to compare themselves against any other brand or sets of brands across a span of time and in any given region. What we're looking at here is we're looking at our brand against a set of competitors, and we're looking at it for the last 3 years, and we're looking at it across the entire country. And we can see that our brand is outperforming the competitors. We have an average Hazel score of about 71 versus the competition at 54, and this is clearly a consistent trend over time. And that's great, but suppose you are a very ambitious food safety team and you're not just happy with being great, you want to be excellent. Are there areas where you might be underperforming, and how do you go about finding out about them? Well, fortunately, our platform also tells you insights about your top performing facilities and your bottom performing facilities, as well as your top and bottom performing regions. Here we're looking at a screenshot that's showing you your bottom performing regions. And for the purposes of today's demo, let's focus in on Ohio. And this is one of the ones that's been flagged as being underperforming. But there are many health departments in Ohio. I mentioned earlier there are 2,500 in the United States, and there are many states that unfortunately have hundreds of health departments. And that's another value that we bring. We bring a level of sort of understanding to explain the health department landscape to our customers. So in this case, we have nearly a dozen Ohio-related health departments, and the one that we are going to be focusing on is the Ohio state-level health department and not one of the many carve-outs that exist in Ohio. So we can zoom in on that, and we see, yes, indeed, we're underperforming. We're in the light blue. We're at about a 52 Hazel score compared to a 56 plus for the jurisdiction. Interestingly, this is despite the fact that when you look at the average number of violations we get in this jurisdiction, we're below the jurisdiction. So you would intuit that we should be getting a better score. So there is something else going on here. And fortunately, we can dig into some of those answers. By looking at the table below, which is hard to see, I will walk you through it. We are showing you all of the violations that you're getting in this jurisdiction, ranked from most frequent to least frequent. So it's basically 1 through 5 here that we're looking at. And if we look at number 2 and number 3, number 2 is related to temperature for dishwashing equipment. And it's the second most common violation that our stores are getting in this jurisdiction. And by the way, we have about 116 stores in this jurisdiction, so it's a very large sample. And this is historical data, so it's going back 3 years. But this violation is only 58th most common in the jurisdiction. And when we look at the percentage differences, our brand is being cited with this violation 14.5 times the rate of the rest of the jurisdiction. Clearly, there is something askew there. There's a similar story with the third most common violation that we're getting. It's only 26th most common for the jurisdiction as a whole. It's related to the use of wiping cloths. And we're getting that violation about 5 times the rate of the rest of the jurisdiction. What this may suggest is that there may be some systematic issues going here that may benefit from either training or retooling or whatever the case may be. But the key here is that we're delivering insight that might otherwise be difficult to uncover. So we talked about some strategic insights. Let's talk about a couple of examples of operational insights. Alerting is one of the most popular capabilities of our platform, and within that, the high-frequency alerts are definitely a fan favorite. What this does is it'll detect anytime there's a pattern of 3 or more inspections in a 90-day window. That usually means you had a routine that was followed by a reinspection that failed, and you now have a second reinspection. And on the email alert on the screen, this bottom facility got 3 inspections in 90 days. The alert was sent on the next day, and this team didn't either see the alert or they didn't take action, and what ended up happening was, sure enough, they ended up getting 3 more inspections in the coming days. This could easily lead to a health department closure, or worse, getting someone sick, etc. So what is the impact when you put this all together? We did a study looking at one of our customers, the quarter immediately before operationalizing our tool to the quarter a year after having done that, and the results were pretty impressive. There was a 6% reduction in violations per inspection, a 5.5% reduction in criticals per inspection, a 47% reduction in the reinspection rate, and a 10% or so increase in the average Hazel score. And all of this analytics we make possible in just a few clicks. We can spin up a basic dashboard for any brand in our coverage area in less than a minute. And because of that, we got some really awesome industry award last year in conjunction with some of our customers. Thank you.
Finished right on time.
I saw you coming.
Yeah. So now I'd like to turn it over to the Sharks for their questions.
Okay, I'm gonna start one, first one.
All right,
Okay, thank you for the overview about what the program can do and what are the results you can really enable the business to get better, take action.
Yep.
Can you maybe tell us briefly about the stories, how you turned into, from a research in the university research into a real, kind of a commercialized program?
Sure, yeah, happy to. I mentioned we're born out of university research, and that's quite a literal statement. In 2013, I was finishing graduate school at UCLA, and I connected with an economist who was a professor there by the name of Philip Leslie, and him and some collaborators had developed a very rudimentary database of health inspection results at the time, just from like maybe 30% or so of the US. And they were studying that and looking at the effects on restaurant hygiene, foodborne illness, restaurant revenues, typical stuff that economists do. And Phil had an inclination that there might be commercial applications for the database and, more importantly, what it could turn into. So he brought me in. I had 3 months to basically do market research. So I was calling, meeting with people in the food industry, a lot of chains. And we very quickly realized that there was some very genuine interest. When we were talking to people, there was a lot of excitement. People were like, when can you get this ready? And we worked with the university to license some of the intellectual property. And we founded the company the following year, 2014. In less than a year, we had our first paying customers. And as they say, the rest is history.
Thank you.
All right, Arash, you're talking with 2 sharks here that happen to know a little bit about health department inspections. You've got Starbucks and McDonald sitting here on the stage.
Sure.
And this, as you mentioned early on, this data is broadly available, right? The health inspection reports that we get after any particular visit. So I understand the value of the aggregation of the data, but you said things that concerned me early on. You talked about data enrichment, and you talked about a proprietary score.
Yes.
So tell me, what are you enriching? What's proprietary about the score, and how does that differ from us just getting the data from the health department directly?
Sure. Enrichment, I gave the example of reinspection prediction. It sounds nebulous and kind of scary. You're predicting reinspections. We're basically filling in gaps in information, and let me tell you what I mean by that. Unfortunately, and we can talk about this later, hopefully, many health departments aren't very good at labeling their data. So they'll just tell you what inspections occurred. They won't tell you if it was a routine, a reinspection, or a complaint. Based on all the data that we have, we've been able to model when a reinspection is a reinspection, just based on the sequencing and the timing. So that's a type of enrichment we're doing. So in the absence of the health department telling us that this was a reinspection, we use our machine learning model to label it as a reinspection.
I see.
Did you still want me to answer the part about the Hazel Score?
Please.
Yeah, so the value that Hazel Score brings, and there's no common scoring metric in any health department that's broadly adopted. First of all, half of health departments don't even do any scoring. They just tell you these are your violations, good luck. And amongst the ones that do scoring, there's letter grade, there's numerical systems, there's demerits, which is a higher score is worse, pass, fail, all these things. So if you want to have a way of even trying to do apples to apples comparisons, like looking at an inspection from Seattle and trying to compare it to one in New York, you need a common language. And the Hazel Score is the best approximation that we've developed for that common language.
All right, that makes sense. Thank you.
Sure.
So how do you see this, the work you're doing to really influence the regulators or at the health department level to make them harmonizing the scores?
Yes. I mean, first and foremost, we hope that the work that we do and the reach that we have motivates health departments to get more of their data online. I think that was a theme that we heard from Julie as well. You know, we don't have perfect coverage. We cover about 94% of the data that's digitally available in the United States, but that only gets us to about a coverage rate of 74% of the population. So we're still missing about a quarter. And it's not just getting online. Like, it's great to be online, but if you're only posting your scores or very limited information about the violations, that limits the actionability. That's also missed opportunity. So we're hoping to really influence health departments to enrich their data, right? Provide all the details, provide the violation description, the inspector comments, the time in and time out, because those are the key pieces of information that the food safety professionals in industry really look at to be able to take action and timely action.
So you mentioned that you're working with US, UK, right, and then also Canada.
Yes.
So what is your observation between those three countries in terms of regulatory inspection?
Yes, so I can comment on US versus Canada because we've had the Canadian data set for longer than the UK. We just added UK last September, so it's been just a little while. The Canadian metrics are a lot lower across the board. So people say people are Canadian nice. It seems to be true in inspections as well. Don't quote me on these exact numbers, but in the US, the average number of violations across all of our data set is about 3 per inspection. In Canada, it's about half of that. And the same holds true for critical violations. I think in the US data set, it's about 1 point something. In Canada, it's like 0.5 something. Those are sort of the macro level trends.
What about UK?
UK, the scoring system is great. It's very intuitive. It's standardized, which is fantastic. The UK does the best job out of the 3 countries in having a standardized scoring system from 0 to 5. But the data richness of what's available online leaves a little bit to be desired. They basically break things out into sort of just 5 categories, but you don't get any inspector comments or details around precisely what was the issue at the location. So I would say that's an opportunity for the FSA.
Thank you.
Well, I have a question building upon Cindy's, and then a separate question with regard to the impact slide that you showed at the end. So the first question, you have UK, US, and Canada data.
Yes.
What about further international reach? What are your plans and timing?
For sure. We're sort of constantly surveying the landscape to see what's coming online, both domestically and abroad. I mean, like I said, there's still opportunity to gain coverage in the US. What we're seeing is that there isn't sufficient volume to go aggressively international. There's pockets in China that are online. There are pockets like in Australia, a couple of...
There isn't sufficient volume in terms of data available, in terms of customer demand.
Data available. I would say customer demand is absolutely there. I mean, if we could, snap our fingers and have coverage of the entire world, I'm sure our customers would love it. We would love to get there, but the fragmentation is even worse, I would say, outside of sort of the, the countries we already have covered. So yeah, we have ambitions as those countries come online for us to grab that data. Localization will definitely become an issue. I mean, we're lucky that the countries that we operate in right now are all English speaking. So there will be that issue to deal with, but that's a relatively trivial issue that we would love to have that problem.
And the second question that I want to ask you pertained to the impact slide. So if memory serves, you talked about a reduction in number of critical findings, a reduction in number of overall violations or demerits, right? And it was all positive performance over time. Aside from the focus that your data provides to an organization as to where to target their resources, I'm curious, what else drove that particular performance improvement? Was it organizations had to devote new resources or restructure, or what's the impact on us as an organization in taking that data and experiencing that same positive performance ourselves?
Yeah, I mean, it can certainly vary by organization, but one of our goals with the tool is to democratize the health inspection data outside of the corporate food safety team, even if it's indirectly, right? Like maybe the data isn't flowing directly down to the store level, but at least it's indirectly flowing through like a remediation plan or something that's initiated by corporate. And it's our belief that if there is awareness within the organization that the voice of the regulator is being listened to and acted upon, and it's not just something that gets filed away in the drawer after the inspector leaves, and we'll wait for them to show up again in 6 months, that just drives behavioral change, that people are kind of in tune with these inspection results and sort of take them seriously.
All right, thank you.
So you've been doing so much on that, and with data, what excites you in this whole, the task and looking at the data and then getting to the company to take action? So what makes you like excited about this day after day?
Yeah, I mean,
in doing this.
I mean, first of all, it's the automation at scale we've been able to achieve. Like we can, with a relatively small team, we have 12 employees right now. We're about to be 15 with some of the hires we're about to make, but it's still a very small team, and we serve almost 200 brands, and that's a testament to the scale and automation we've built. But that's sort of past contribution. Going forward, the things that excite us are the predictive capabilities that exist in the data, and we're just starting to scratch the surface on that, and augmenting the data set to round out the food safety picture. I mean, obviously voice of regulator is important, but it's not the end all be all. So collating that with third-party audit data, HACCP controls, equipment monitoring, temperature monitoring, and even social media data. I mean, there's a lot of great sentiment analysis that can be done. So we're starting to bring that into the fold, and in the coming years, you'll see a much more broader multi-source data platform.
Thank you.
So I think we might have time for one final question, and you touched on it just a second ago with regard to predictive. So given the nature of this plenary and where we're headed in terms of not only analyzing new sources of data, but modeling it and using advanced analytics to predict next steps, how do you use this for predictive?
Yeah, so we are the current project that's on the data science team's plate is to try to predict next inspection outcome. So based on not just the individual locations' performance history, but also the patterns in the most recent violations that are being cited by that inspector or zip code, trying to predict the most likely issues on the upcoming inspection. That's just one example. A corollary to that is also the timing of that next inspection. Health inspections are typically pretty infrequent, so even being able to get a 30 to 45 day heads up can really help the team on the ground.